Hello, this is Jeff Swenson. We're back talking about interscaling blocks. We'd like to give you some examples of in-plane and out-of-plane approaches with actual ultrasounds. Before we do this, we'd like to review. In this slide, on the left side of the image, we see the relationship between the transducer and the needle when using an out-of-plane approach. And on the right image here on this slide, we see the relationship between the needle and the transducer when using an in-plane approach. Remember, when we approach the brachial plexus at the interscalene level, we go through the middle scalene muscle using either an out-of-plane or an in-plane approach. In both techniques, as we advance the needle towards the anterior border of the middle scalene muscle, we give small doses of local anesthetic which appear hypoechoic on the screen. As the needle passes through the anterior border of the middle scalene muscle, and into the space between the scalene muscle and the brachial plexus, we get a characteristic distribution of local anesthetic. This characteristic distribution occurs between the scalene muscle and the connective tissue surrounding the brachial plexus. It's very common for the initial appearance of local anesthetic to only be on the middle scalene side of the brachial plexus and for there not to be any apparent distribution on the anterior side. This is very common and still will result in a good block. We try to avoid injecting within the substance of the brachial plexus or deep to the connective tissue surrounding the brachial plexus for two reasons. Number one, it's not necessary to get a good block. And number two, the connective tissue which surrounds the brachial plexus is rather confining and it's difficult to pass a catheter within this space compared to within the interscalene space. This is an example of a brachial plexus approach at the interscalene level going through the middle scalene muscle. We have the brachial plexus surrounded by the white oval. The middle scalene is on the left and the anterior scalene is on the right. Now we have injected a small amount of local anesthetic into the substance of the middle scalene muscle on the left, which is why the appearance of the middle scalene muscle is a little different than the anterior scalene. As we see our needle advancing through the middle scalene muscle, we will give a small dose of local anesthetic as we get close to the anterior border, which appears hypoechoic. And when we pass through the anterior border of the middle scalene, we get that characteristic pattern that we see right here. Notice at the end of our injection, we have a nice distribution of local anesthetic between the middle scalene and the brachial plexus. The brachial plexus and its connective tissue surrounding it is not expanded, and we do not have very much local anesthetic on the anterior side, and this is pretty common. This is another example of an out-of-plane approach to the interscalene space. Middle scalene on the left, brachial plexus demonstrated by the white oval, and the anterior scalene on the right. As we advance our needle, we inject small doses which appear hypoechoic on the screen, advance it a little bit more, and we get into the tissue plane between the middle scalene and the brachial plexus. You'll notice in this case we see a little bit more drug on the anterior scalene side of the brachial plexus. Here's the brachial plexus surrounded by a white oval. Notice that it did not expand, but the space between the scalene muscles and the connective tissue of the brachial plexus did. So this is what we like to see. This is an example of an out-of-plane approach again on the right side of the neck, middle scalene, brachial plexus, anterior scalene. As we advance the needle, we see hypoechoic local anesthetic as we inject. We don't see the needle tip. We do see our local anesthetic. And once again, we develop a tissue plane between the middle scalene and the brachial plexus. And once again, at the termination of our injection, we have expanded the space between the scalene muscles and the brachial plexus, but the absolute volume of the brachial plexus and its surrounding connective tissue remains the same. So we did not expand that space. Here's an out-of-plane approach on the left side of the neck, anterior scalene on the left, middle scalene, brachial plexus. Here's the approach of our needle. We see some local anesthetic expanding the space between the middle scalene and the brachial plexus. And you'll notice at the end of this injection, once again, we see a very good distribution of local anesthetic between the middle scalene and the brachial plexus. Here's the brachial plexus, which has not expanded, and here is our anterior scalene side, which does not appear to have any drug in that space, and yet this is still a successful block. Here's an in-plane approach on the left side, and this is a very, very readily visible tissue plane. As we slowly advance our needle, you will see a very distinct tissue plane once again develop between the middle scalene and the connective tissue surrounding the brachial plexus. So here is that very, very visible tissue plane, but once again doesn't appear to be a lot of drug on the anterior scalene side, and once again this is a very successful block. So here is the tissue plane between the brachial plexus and the middle scalene, but not much on the opposite side. Once again, this block still works just fine the way it looks here. This is one more example of an in-plane approach on the left side of the neck. Here's the anterior scalene, brachial plexus surrounded by the white oval, and middle scalene. Here's our needle. Once again, small doses of local hypoechoic on the screen. We get a nice tissue plane again. And at the end of our injection, we have a nice tissue plane between the middle scalene and the connective tissue surrounding the brachial plexus, but not a lot of drug on the anterior scalene side. And once again, this is still a successful block. So here's our tissue plane between the connective tissue of the brachial plexus and the middle scalene with a large hypoechoic space representing the local anesthetic. But not a lot on the anterior scalene side, but still successful. One last example. This is a in-plane approach on the right side of the neck. We're going through the middle scalene muscle and injecting, creating a tissue plane between the middle scalene and the brachial plexus. And once again, doesn't appear to be a lot of drug on the anterior side, but a nice space between the middle scalene and the brachial plexus represented by a large hypoechoic space. Next time we'll show you some things to watch out for during an interscalene block and some abnormal anatomic features.